And Matt, maybe we can start with you this time. What are some of the common pains and or conditions that Egoscue can help people with?
Yeah, so we see a lot of different symptoms and conditions that people experience, and listing them off, not limited to these, but I think the biggest things is low back pain, like hip pain, so sciatic pain, arthritis, and like osteoarthritis, um, hurt disc issues, so bulging discs, herniated discs. Um, Ankle pain, knee pain, and going along with arthritis, see a lot of people who are looking to stave off a knee replacement or avoid a knee replacement altogether, hip replacement. See people with shoulder pain, numbness, tingling in the hands, in the feet. So on top of all those musculoskeletal conditions, we also help people with digestive issues, circulatory issues, headaches, migraines, TMJ, so jaw pain, just actually sleep. Some people, need help, sleeping and comfortably sleeping, so we help with that. It's really like we talked about before, the alignment of the body, the structure of the body impacts so many things from systemic, so digestive, circulation, and then musculoskeletal. That if the alignment affects it, we help people with it, and we see people with it. And the cool thing is just how how the body's innate healing process. Our bodies are all designed to heal. Once we give it the ability to heal, it does. So now I'm going off the arthritis. That big thing, osteoarthritis. We see. We had a client. We see a lot of people every day with that. A client, Barbara, recently, who was told that she needed a knee replacement, and she was 60. And her big thing was, I'm too young to go through that. She's very active, and wants to keep it that way, and knows if she gets that knee replacement, the knee will never be the same, because of the prosthesis in there. So really bad knee pain, level 8, that she described it as, and very limited. And and working with her, and realigning the knee as well as the surrounding low joints of it, the ankle and hip being big low joints that impact the knee condition because of the knee position. She's out there moving just fine now, has no pain in the knee, is able to live that active lifestyle that she wants to, and like we said before, deserves to live. So it's really amazing what the body can do, as long as we give it the chance to do it.
Yeah, cool. That was it's a great example, and adds to your Bubba Gump answer there.
Yeah.
All the ways you can.
How many different kinds of shrimp, right? Yeah. Yeah.
So maybe you left one or two in there for Elisa or Lisa. Lisa, are there any that you would add to that? Or I know Egoscue, we get a lot of people from currently from like Bulletproof and Dave Asprey, and then also from like Tony Robbins and a lot of the events that he does, and he highly recommends our program as well. Are those people typically coming in with pain also, or are there other avenues or things that they're looking for as well?
I'd say some do, either, if it's something that's happening right now or they've experienced in the past, and then going through a program like Tony Robbins, whether it's just your basic UPW or if they're really going, through the whole mind body transformation. There can be a mental component to pain. There's on the holistic side of things, pain in certain regions can be tied to different emotional stresses. So sometimes they come to us because they can see that connection and need a little bit of help, getting their alignment.
Uh-oh, you lose her?
Oh, she's frozen.
I think the last word was alignment.
Alignment. Yeah, we'll go. Yeah, I think that was it. We'll go with that.
We'll see if she gets unfrozen.
Yeah.
Elisa, what would you add to that?
Something that came to mind is also helping people with conditions that they were born with, or things that they've been told can't be changed. A big one that comes to mind is scoliosis.
Great.
And I just saw a client this week for the first time with scoliosis, and we just did a quick introduction with a couple of exercises, 2 exercises. And right away she saw a big difference in the position of her hips. And something that's really powerful specifically with scoliosis is just remembering this whole body approach, that your spine is literally sandwiched between your shoulders and your hips. So if you can influence the hip position and the shoulder position, then you're going to influence the spine. And she saw that right away, and that was really cool. So just seeing people change things that they thought were unchangeable, that they were born with, it's pretty cool. But she's back.
There she is.
Hi, I don't know what happened. Sorry.
No worries. I think Elisa picked up where you were kind of leaving off there.
Lisa, that scoliosis is going too, because we see a lot of kids actually, with scoliosis and looking to, correct it before, it, as people are told, it gets worse, right. There's no cure for it. So, yeah.
Yeah. Or the other alternative is surgery. And
surgery or bracing.
Just like stick a bunch of metal rods along your spine and you're good to go.
Yeah. There were some studies that came out for a while there that said that exercise is not effective for fixing scoliosis. And I think that becomes a deterrent then, because then it takes the sort of empowerment out of the hands of the individuals to do something, which is a shame, because, you can just look back at some of the posts previously and see some of the, like even those x-rays, there's one picture that comes to mind, but just taking out the curve. And today I would say even more so, we get a lot of people who have functional scoliosis, right? Which is not a congenital thing, but so scoliosis defined, of course, is just lateral flexion of the spine with rotation, right? So those two conditions exist, then you have quote unquote scoliosis. And we see that literally every day. In most of the population has that now.
Yeah.
Right. Yeah. And simplifying it, muscles move the bones in the body, right? So if we see a bony deviation in the spine with scoliosis, there's a muscle, imbalance that's pulling it there. Mm-hmm. So then if there's a muscle imbalance that's pulling it there, correcting the muscle imbalance and getting the right muscles that hold the spine in the right position to activate will then in turn reduce the scoliosis, the bony misalignment. So it can be a scary thing to be told that, and the fix, if you will, quote unquote, is it's quite simple in that sense.
Yeah.
In the sense that muscles move the bones.
Yeah.
Yeah, for sure.
Yeah.